What about management of kind of these late effects? So, I see tons of patients, and many of the things that bother them, continually bother them today, is neuropathy. It's some of the late onset leukemias that can happen from the chemotherapy that they've received. It's the lymphedema from the previous treatment. Can you share any of those experiences?
I'm calling Dr. Rozelle all the time for my my things that I think I'm having. Initially, I thought I was having some neuropathy, but again, my access to you, I think, is unique because you're not only my provider, you're my friend, but someone out there in the world who probably doesn't have access to their provider, that may be a little bit more difficult. So, you know, I wonder how those people will maneuver through these things. I mean, just a week ago, I had lymphedema. I thought it was from working out. My whole right arm, swole up. I can send a text and say, hey, my arm is swollen up, and you told me what to do. I noticed that healing on this side of my body is like, if I get a scratch, it takes longer to heal, or a biopsy or something like that, which I just received. That's something that I noticed that's different too. But I think still a part of that comprehensive team should be some kind of access to contact, or to even a nurse contact, so you can say, hey, this is going on, who can I talk to? Even though you guys did a great job at explaining these things that will happen,
Absolutely.
when they actually happen, you just need that reassurance and say, hey, this is okay, just buy a sleeve, which I did. The lymphedema will go down, which it did. But I think having someone just reassure you of that should be something that patients should have ongoing.